Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Preventing strokes. Introduction. A stroke or a brain attack is a serious condition that needs emergency medical treatment. Millions of people worldwide die from strokes each year. Millions more become permanently disabled following a stroke. This patient education program explains what strokes are. It discusses their causes and provides tips for preventing strokes. What is a stroke? The brain controls most functions of the body. It allows us to think, understand, speak, move, and feel. To work correctly, the brain constantly needs oxygen and sugar, or glucose. Oxygen and glucose are carried to the brain through the blood. A stroke happens when blood is not able to reach the brain. When the brain does not receive its needed blood supply, brain cells begin to die and the brain can't function correctly. A stroke can affect the entire body. The effects of a stroke range from mild to severe. A stroke can cause paralysis, emotional problems, and problems with thinking and speaking.
A transient ischemic attack, or TIA, is like a stroke, but it does not last long. It happens when an artery that goes to the brain is blocked for a few seconds to a few hours. This causes stroke-like symptoms that improve in less than 24 hours. There are two types of strokes. The first type is called an ischemic stroke. An ischemic stroke happens when an artery in the neck or brain gets blocked by a blood clot or a piece of fatty material called plaque. The blood vessel may already be narrowed by plaque buildup. This blocks the flow of blood to the brain. The other type of stroke is called a hemorrhagic stroke. A hemorrhagic stroke happens when a blood vessel in the brain breaks. This causes blood to leak into the brain, which kills brain cells. Causes. Strokes may be caused by heart problems or by a buildup of plaque in the arteries. The risk of stroke may be increased by high blood pressure, by problems associated with high cholesterol, diabetes, or by diseases that cause the blood to clot more easily than normal. Damage to the carotid and vertebral arteries can cause cholesterol to build up in them. This is known as plaque. This can lead to decreased blood flow to the brain and can cause strokes. Pieces of plaque can break loose and move through the arteries to the brain. Blood clots can also break loose and travel through the arteries. This can clog smaller arteries, which leads to strokes. This is known as embolism. Sometimes a blood clot will form inside a blood vessel in the brain or neck. This can block blood flow to the brain. This is called thrombosis. Heart problems can cause blood clots to form inside the heart. Some of these clots can break loose and move to the brain, blocking blood vessels in the brain and causing strokes. This is also known as embolism. When a person has high blood pressure or hypertension for a long time, blood vessels in the brain can become damaged. Hypertension can cause the blood vessels to narrow. This could make a stroke more likely. When arteries become narrow, it is called stenosis. High blood pressure can also make blood vessels weaker, which could cause bleeding inside the brain. Smoking and drug abuse increase the risk of blood vessel problems and strokes. You can reduce your risk of getting a stroke by changing certain lifestyle habits that damage the blood vessels of the body. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Prevention. Preventing strokes is much easier than treating them after they happen. You can also help prevent strokes from happening again if you've already had one. This section discusses how to prevent strokes. There are certain factors that increase your risk of having a stroke. These are called stroke risk factors. Some risk factors of stroke are things you cannot change. These include factors such as age, gender, and race. For example, an older person generally has a higher risk of having a stroke than a younger person. Other risk factors of stroke are things you can change. You can reduce your chance of having a stroke by controlling your blood pressure, your cholesterol levels, diabetes, smoking and drinking habits, weight and activity level, irregular heartbeats. Your healthcare provider may prescribe medications to help reduce your risk of stroke. Some of these medications should not be taken with other over-the-counter drugs, supplements, and herbal remedies. Check with your healthcare provider before taking any other supplements or medicines. Manage the risk factors you can control. Making healthy changes to your lifestyle can help decrease your chance of having a stroke or having another stroke. Controlling high blood pressure. High blood pressure is also called hypertension. This is the most important factor that causes strokes. Check your blood pressure regularly. Your healthcare provider will prescribe medication if your blood pressure is too high. Chronic high blood pressure can damage the artery either by causing the artery walls to become thinner and weaker than usual, which increases the chance of bleeding in the brain, also known as a hemorrhagic stroke, or by allowing plaque to grow in the damaged parts of the artery, which then leads to narrowing of the artery and its potential blockage. Here are some ways you can control your blood pressure. Maintain proper body weight and avoid obesity. Avoid drugs known to raise blood pressure. Cut down on salt and processed food with added sodium. You can also help control your blood pressure by eating more vegetables and eating fruit in moderation, exercising regularly under the supervision of your healthcare provider, taking blood pressure medication if you need it. Controlling blood pressure will also help you avoid heart disease and kidney failure. Controlling cholesterol. Cholesterol is a fatty substance in the body. Damage to your blood vessels can cause cholesterol to deposit and block them. This condition is called atherosclerosis. Atherosclerosis causes heart and vascular disease. These are the leading cause of death in the world. By practicing healthy habits, you can improve the health of the blood vessels in your heart and brain. When the blood vessels of your heart and brain are healthy, it is less likely that a stroke will happen. Ask your healthcare provider for information about your bad and good cholesterol levels and your triglycerides levels. HDL stands for high-density lipoprotein and is known as good cholesterol. LDL stands for low-density lipoprotein and is known as bad cholesterol. Depending on your health and risk level, your healthcare provider may give you medication to lower your bad cholesterol to less than 70 milligrams per deciliter. Triglycerides are a type of fat found in the blood and fat cells. High levels of triglycerides in the blood can raise your risk of stroke. You can lower the risks associated with bad cholesterol by eating healthy, exercising and losing weight if you are overweight, taking cholesterol and triglyceride-lowering medications if you need them. Smoking cessation. Cigarette smoking has been linked to the buildup of fatty substances in the carotid artery. The blockage of this artery is one of the main causes of strokes. Scientists believe that smoking damages the inner lining of the arteries. When the arteries are damaged, cholesterol is sent to the inner lining to patch up the damage. This process causes plaque to build up and narrow the artery, making a stroke more likely. The nicotine in cigarettes and other tobacco products raises blood pressure. Cigarette smoke makes the blood thicker and more likely to clot. People at any age can reduce the risk of stroke, lung cancer, lung disease, and heart disease by quitting smoking. If you have heartbeat problems or problems with blood clots, managing these medical conditions can help you reduce your chance of having a stroke. See your healthcare provider for help managing these conditions. Preventing and treating diabetes. Diabetes is a disease marked by high blood sugar levels. High blood sugar can damage the arteries over time. Damaged arteries can collect plaque and increase your risk for blood clots. This raises your risk of stroke. Having type 1 diabetes means that your body does not make enough insulin. Type 2 diabetes is much more common than type 1. Type 2 diabetes means that your body makes too little insulin or your cells do not use insulin the right way. If you have type 1 or type 2 diabetes, healthy lifestyle habits can reduce your risk of stroke and other complications. A healthy lifestyle also helps prevent type 2 diabetes. Your exercise plan should include both aerobic activity and strength training. Aerobic activity includes movement that makes you breathe a little faster, such as walking or riding a bike. Activity can help reduce blood sugar levels and improve your cell's response to insulin. Eating a balanced diet and using portion control can help you prevent or manage type 2 diabetes. Eat a variety of vegetables, fruits, whole grains, and lean sources of protein. Losing extra weight can also help you manage or prevent type 2 diabetes. Even losing a few pounds can improve your health and reduce your risk of developing diabetes. Checking your blood sugar levels regularly and taking insulin or other prescribed medications are very important in helping you manage type 1 or type 2 diabetes.
If you like this video, please like and share. For similar videos, subscribe to our channel. Summary.
A stroke or a brain attack is a serious condition that needs emergency medical treatment. A stroke happens when blood is not able to reach the brain. When the brain does not receive its needed blood supply, brain cells begin to die and the brain can't function correctly. Strokes may be caused by heart problems or by a buildup of plaque in the arteries. TIAs, or transient ischemic attacks, happen when a blood vessel is blocked temporarily. Ischemic strokes happen when a blood vessel is blocked completely. Hemorrhagic strokes happen when a blood vessel bursts. Your risk of stroke may be increased by smoking, drug use, high blood pressure, problems associated with high cholesterol, diabetes, and diseases that cause the blood to clot more easily than normal. Here are some ways you can control your blood pressure. Maintain proper body weight and avoid obesity. Avoid drugs known to raise blood pressure. Cut down on salt and processed food with added sodium. You can also help control your blood pressure by eating more vegetables and eating fruit in moderation. Exercising regularly under the supervision of your healthcare provider. Taking blood pressure medication if you need it. You can lower the risks associated with bad cholesterol by eating healthy, exercising and losing weight if you are overweight, taking cholesterol-lowering medications if you need them. Ask your healthcare provider for resources to help you learn more about your cholesterol levels. You can help reduce your risk of stroke by preventing and controlling type 2 diabetes and managing type 1 diabetes. This is done by participating in physical activity on a regular basis, eating a balanced diet and using portion control, losing any extra weight, checking your blood sugar and taking insulin or other prescribed medications. Preventing strokes is much easier than treating them after they happen. You can also help prevent strokes from happening again if you've already had one. Making healthy changes to your lifestyle can help decrease your chance of having a stroke or having another stroke. Thank you for using Explain.